1 minute until our panelists are seated, and then Carl will take over.
So are you coming to the VIP reception tonight? Mm-hmm. Yes, you are. So afterwards we can go and hang. Yes, yes.
I don't know about you, Harshad, but I get so tired of the photographers following me like that. Good afternoon, everybody. My name is Carl Hoffman. I'm the president of PSI and delighted to be with you here today and with these distinguished panelists. In 90 minutes today, we're going to try and address a topic that has frankly challenged our species for millennia: women's health. And fortunately, we have some very eminent people with us who will help us put this broad topic into some useful and tangible perspectives. Nearly 20 years ago, the IPCD in Cairo called for a holistic, woman-centered approach to reproductive health. And this comprehensive approach encompassed family planning, safe pregnancy and delivery services, abortion where legal, prevention and treatment of STIs, information and counseling on sexuality, elimination of harmful practices against women, such as forced marriage, and more. Now, the obstacles to achieving what we aimed for in 1994 turned out to be many and varied. Everything from economic challenges to the entrenched power of the patriarchy. Our progress in global health generally over the past 2 decades has not only highlighted where our Cairo ambitions have fallen short, but also has helped us to understand that women's health, including reproductive health, must be taken much more broadly if we're to make the progress that we aim for. Our lens, wide as it was, turns out to have been too narrowly focused. Now, even if our collective efforts over the past 20 years to improve the lives of women around the world have not met our ambitions, this same period has nonetheless given us some important new tools, insights, and understandings to help us do better. And our panelists today represent the energy, the innovation, and dare I say, the optimism that we need to up our game going forward. Let me introduce them. First, Dr. Harshad Sanghvi is Vice President and Medical Director for JPIGO. Now, JPIGO is one of those great institutions whose renown and contributions to global health are known far and wide, despite its unconventional name, not because of it. And as a marketer, I say that in admiration. So Harshad has for more than 20 years led global efforts in emergency obstetric care, family planning, maternal mortality, cervical cancer, and many other areas. His pioneering team has won numerous awards for innovations in saving lives. Her Royal Highness, Princess Mette-Marit of Norway, has for more than 10 years devoted her energies to global advocacy and change around social inclusion, the environment, HIV/AIDS, and other important topics. She serves as special representative of UNAIDS. She is a leader of women leaders around the world who are mobilizing to improve the lives of girls and women in new and exciting ways. Barbara Bush is the co-founder and chief executive of the Global Health Corps, which since 2009 has worked to place committed and talented people from the global north and global south in creative situations of support to meet today's global health challenges. She's traveled and worked widely in global health environments in Africa. I learned the other evening that competition to be one of Barbara's Global Health Corps Fellows is more intense than achieving admission to Yale University. So she's obviously attracting some real talent. Dr. Anna Langer is director of the Women in Health Initiative at the Harvard School of Public Health and a professor in that institution's Department of Global Health and Population. Anna was previously CEO of Engender Health for 5 years and regional director for the Population Council for over 10 years in Mexico. She's widely published and acknowledged for her scholarship and leadership on women's health issues from a clinical, a psychosocial, and a policy perspective, to name just a few. And finally, Dr. Babatunde Oshotimehen is, as we all know, Executive Director of UNFPA, and in that capacity is one of the anchors of the international governance structure around which so many of our organizations coalesce. He's also Under-Secretary General of the United Nations, and he works for a Secretary General who has done more than any of his predecessors to bring issues of women and girls to the forefront of consciousness of what is, and let's be honest, a male-dominated global political decision-making elite. Professor Babatunde was previously Federal Minister of Health in Nigeria, as well as Director General of Nigeria's AIDS Control Agency. So 5 very eminent and creative thinkers. But we have the additional privilege of hearing from a panelist who's not able to be here with us in person, but who wanted to send us a message, and that is Kathleen Sebelius, a member of President Obama's cabinet since 2009 and United States Secretary of Health and Human Services. Previously, Secretary Sebelius was governor of the American state of Kansas. Can we roll Secretary Sebelius's remarks, please?
Hello, I'm Kathleen Sebelius, Secretary of the U.S. Department of Health and Human Services. I wish I could join you for such an important gathering, and I'm thankful to Women Deliver for inviting me to participate in the dialogue on one of our great health and moral challenges. Every 2 minutes, somewhere in the world, a woman dies during pregnancy or delivery, and her child is 7 times more likely to die within 12 months. That burden of maternal and child mortality is heavily shouldered by developing countries, but it affects developed countries also. Women on every continent share similar barriers to care and disparities in health outcomes, from the lack of access to basic maternity services to life-threatening health disorders like hypertension and hemorrhage. And AIDS is now the leading cause of death for women of reproductive age worldwide. But we also know what's needed to improve care and reduce those disparities, regardless of where we live. Women need safe home environments and reliable transportation. They need family planning, which is one of the most important health interventions that now serves 645 million women of reproductive age throughout the world. With PEPFAR and partnerships like Saving Mothers, Giving Life, we're making progress on ending mother-to-child HIV transmission and providing essential care during labor, delivery, and the first hours after birth. But we still have much more to do to reach our goals. Everywhere I travel as secretary, from Moscow to Nairobi to neighborhoods across America, health leaders are trying to solve the same problems. And we're realizing that we find solutions much faster when we learn from one another. In the United States, we enacted an historic health law because access to health care, which is crucial during pregnancy, is often dependent on a woman's ability to get health insurance. Our new law gives women more control over their maternal and reproductive needs through free preventive services and ends the insurance company practices of charging women more for the same health insurance simply because of our unique health needs. But what more can we learn from each other to improve access to care and the delivery of care? Answering questions like that is why this conference is so important. Bringing together voices from around the world, you're making a singular call to find solutions and deliver change. But we know our work is far from over. So as you join in the important work at Women Deliver, I encourage you to assess the state of women's health in your home countries. No investment has a bigger payoff than maternal and child health, in lives saved, in communities and countries strengthened. We all know the urgency. We have no time to lose. Every minute counts. Thank you, and I look forward to our continued work together.
Thank you, Secretary Sebelius. So now let's get into it. Harshad, you've been at the forefront of new thinking about women's health, new technologies, about both challenges and opportunities. Share with us your context, your appreciation of this.
Thank you. Well, thank you very much. I think this is an incredible opportunity for me to share my thoughts on a more holistic, women-centered approach. One common theme, I think, among all of us in this room are that we are in the business of creating change. We create change because the current situation regarding the very high mortality and mobility, especially in developing nations, is unacceptable. We create change because inequity in access to health care between poor and the rich, between men and women, between boys and girls, is unacceptable in civilized nations. But more importantly, we create change because we already have the scientific evidence and the technology for interventions that can save millions of lives today. For me, it's been a huge pleasure to work with Jipaigo. In 1984, we demonstrated in Zimbabwe that a simple test using kitchen vinegar could help detect cervical cancer. In the next 2 years, we showed in Thailand that trained nurses could not only detect cervical cancer, but could treat them immediately without, for the most part, the need for laboratories or pathologists. And so the single visit approach was born, a major paradigm shift that is now allowing more than 30 countries to have scaled up cervical cancer prevention programs. I'm mentioning cervical cancer because these are some of the other unanswered questions that we need to address seriously. So an added benefit of treating women on the day in which we are screened is that women who are undergoing screening are spared the anxiety of waiting for the result that may never come. And many, many women are unable then to go to those health centers again, especially rural women in Africa and Asia. But the sad fact is that after 15 years of this evidence being available, and this inexpensive strategy being available, there are still millions of women who do not get care or preventive care for cervical cancer. And now more recently, we have a vaccine that protects girls from cervical cancer. In Uganda, PATH have demonstrated that it's feasible and effective to get every schoolgirl vaccinated. And in Thailand and Philippines, in a unique program, the Mother-Daughter Initiative, Jipaigo has demonstrated that women who are attending our programs are very happy to bring their daughters for vaccination so that both of them can be protected. And these nations are paving the way for a new paradigm that's aimed at adolescent girls. But again, the sad fact is that it will take developing countries many, many years to implement such programs. So it is a time to make a commitment to prevent cervical cancer in our lifetime. This is the time to make that commitment. We cannot, I think developing countries, and particularly low-resource countries, cannot afford not to provide this vaccine because it is so much more expensive to treat cancers. That's really important. Let me take one other example, ladies and gentlemen. This is really neglected and forgotten or ignored portion of our problem. 1 in 3 women will experience gender-based violence in our lifetime. in 2 consecutive studies on maternal death in Nepal, 10 years apart, one unexpected finding was the increasingly higher proportion of women compelled to commit suicide because of the mental and physical abuse during the course of their pregnancy. And in neighboring India, there are many, many women who suffer abuse and violence in the hands of their spouses for reasons of infertility. I went to medical school in Kenya 25 years ago, and nothing in my training prepared me for how to recognize gender-based violence in women, how to provide care, or how to prevent it. And unfortunately, I don't believe that much has changed in that 25 years. Let me tell you a story of Kiranjit Ahluwalia, a young Asian woman who for years suffered unimaginable abuse and violence at the hand of her husband, while their families and neighbors stood by and did nothing. And after years of such torture, Kiranjit retaliated, and one night, after a particularly horrible beating, set her husband on fire. My cousin, who was her pro bono lawyer, visited her in prison many months later and inquired how she was. And this is what she said. She says, "I am happy here in prison. I feel safer than I've ever felt in my entire life. I'll repeat this. I am happy here in prison. I feel safer than I've ever felt, ever in my whole life." Now, Kiranjit was one of the fortunate people, despite all of her tragedies. She was released from prison on appeal and has created a new life for herself. But there are millions of women today who remain without protection, without care, and without justice. It is time to break this silence so families and communities are more vigilant, health and social workers are better prepared, and societies refuse to tolerate the violence in their midst. And finally, let me address one last area which I think is critical as we expand our vision for women's health. Let me address the area of work that I believe holds the largest amount of promise for the healthcare of women, especially those who are marginalized and underserved in Africa and Asia. Some 50% of women do not have easy access to any kind of health services. For me, it has been a great pleasure to work with non-literate community health volunteers in Kenya, in Indonesia, in Nepal, in Afghanistan. These volunteers, in one example, were able to identify pregnant women in their communities, provide them with sufficient education about postpartum hemorrhage, distribute the medication misoprostol so that women could protect themselves against bleeding after birth, and then went and distributed this medication and followed them up after birth, protecting many, many women. These volunteers have the capability of reaching everyone and overcoming the first and second delays that is the major cause of maternal death and disability, something that facility-based services can never hope to do. And these volunteers work for no fees, but are motivated by the creativity of their leaders and their community. These community health volunteers, almost all women, many illiterate, but I have learned a very important lesson, and that is never to allow illiteracy to be confused with the lack of intelligence. It is time for us to fully harness the huge resource available to every nation, this huge resource available to every nation on earth to take care of women, and not just be satisfied by waiting for women to reach facilities. We already have the simple new technologies that allow non-literate volunteers to detect many non-communicable diseases such as hypertension, preeclampsia, anemia, diabetes, if we are willing to trust community health workers to provide this door-to-door. With better simulation training, such as helping babies breathe or helping mothers survive, we can take life-saving interventions much closer to to where women are having problems. In Mozambique, community health workers were trained to offer HIV testing at homes. Many of these women have never had any health contact and were so delighted that a service to protect women was now available right at their doorsteps. As a result, testing rates and adoption of prevention of mother-to-child transmission have tripled in this particular area. And we are getting closer to universal coverage. And we can make many contraceptives available by community distribution. Even injectables can be safely distributed by these community workers. So if we really want universal coverage of all women at risk, Chapaigo believes that taking care to women to their homes will be critical, and we must work, all of us work, to remove all those policy barriers that prevent such reach. Every woman has a right to such care, especially those that are hardest to reach. Now, many in the development world make the argument that women are needed as mothers, as wives, as caregivers. Whilst this is true, their value is not simply for what they do for others. They have individual intrinsic value themselves. Their lives should be saved, not just to care for the newborn, but because they should not die. And so let us remain in this business of change till our job is done. Thank you.
Thank you. Thank you, Harshad, for those inspirational thoughts. Your Royal Highness, you have been active in many different aspects of women's health. One of the most important of these is your work in HIV, which, of course, is a disease disproportionately affecting women. What have we learned about HIV in the last 20 years that allows us to leverage better approaches to women's health going forward?
Thank you, Carl. I'll go up here as well and try to respond. Well, Excellencies, ladies and gentlemen, friends, I'm very pleased to be here to discuss this very important issue. In my role as UNAIDS International Ambassador, most of my work has been focused on HIV/AIDS, especially young leadership in this area in particular. And as we are discussing what our development agenda post-2015 should be, we increasingly see that we have to address several health challenges. On one hand, we need to address the health-related MDGs together, and I think this conference is a perfect example on how we can work to create synergies in our work across MDGs 4, 5, and 6. But on the other hand, there are also new challenges that really needs to be addressed at the same time, non-communicable diseases. And how to address all of these challenges in an integrated manner is really the topic, I think, of today's discussion. And it's a very important topic moving forward in the development agenda. I want to address 3 issues in particular: the need for a holistic approach to women's health, the urgent need for investing in girls, and finally give some encouraging examples of public-private partnerships, models for moving forward. And how can we provide women and girls with integrated health services is one of the questions we should try to look at. Included services and products for addressing HIV and sexual reproductive health that upholds the rights of women and girls. How can we meet women and girls where they are and in ways that they can relate to? Fortunately, we already have many of the tools that we need. Over the past few years, the global health community and its partners, including many of you in this room, have helped to expand access to products and services that have altered the trajectory of HIV. But the reality, as you know, Carl, is that the funding landscape for global health is shifting. As you mentioned, there is a major disparity that exists between diseases and the money needed to combat them. In particular, public funding is scarcer today than it was in the past, so we can no longer expect governments alone to address the serious health challenges of women and girls. And where can we look to answer this challenge? First of all, I believe that we must identify bold new solutions with potential for major and targeted impact. For example, HIV home testing, which has been successful in wealthy countries, has the potential to change how people learn their status in developing countries. This could mean millions of more people accessing treatment earlier. Another example would be integrating TB screening for women and girls in a broader suite of health services, making high-quality TB treatment available through the private sector. Importantly, we must integrate services and psychosocial support for addressing violence against women into comprehensive quality services for sexual and reproductive health and HIV. Secondly, I think we all must together make a major call for private investments to jumpstarting and providing sustained funding for these sorts of interventions. As the previous speaker talked about, the cervical cancer swab is a great example of an initiative that, had it been providing with private funding to jumpstart that, we could have seen major results already, I think. This type of seed funding could unlock governments and institutional funding and have a major effect in global health. We already have some great examples of public-private partnerships in global health. Foundations are present on the board together with several countries, among them Norway, in both the Global Fund and of UNITAID, two organizations that both work to fight HIV/AIDS. Norway's own Prime Minister Stoltenberg and Nigeria's President Jonathan chaired the UN Commission on Life-Saving Commodities for Women and Children. And we all know, as a follow-up on the Commission's work, private pharmaceutical companies have joined in a volume guarantee agreement to make contraceptive implants accessible to women in the poorest countries in the world. We should encourage more public-private partnerships. The investment case is strong, and the impact could be momentous. We know that investments in women and girls are not only cost-effective, but also critical to the HIV response and wider development. We know that a healthy, educated girl will reinvest 90% of her future earnings into her family and into her community. And we know that when women are healthier, economies thrive. Last year, when I was in India with PSI, I witnessed firsthand the power of this type of investment. In a Delhi slum, I met 8-year-old Manisha. She contracted HIV from a blood transfusion and then nearly died from a TB infection shortly after. Sadly, children like Manisha contract HIV mostly from vertical transmission and are less than half as likely as adults to get treatment. Manisha was one of the fortunate ones. During our visits, she was being treated by an organization called Operation Asha. It's a small, innovative organization that uses state-of-the-art technology provided by Microsoft to provide treatment and services to TB patients. So Operation Asha meets patients where they are. Manisha's center is in a small shop in her home district. When patients come to an Operation Asha center, their finger is scanned and their identity is uploaded to a database through a laptop. Then they are tested for TB, and if they test positive, they immediately start a 6-month treatment course monitored closely by Asha community workers. It's an incredible leap in technology and access, but the organization doesn't stop at TB care. It also uses its centers to distribute food rations, blankets, educational material, and nutritional supplements to those in the slums. It's examples like that that make me hopeful that one day having HIV will not mean that girls like Manisha are robbed of a future. I encourage all of us to be firm in our actions in supporting women's and girls' right to sexual and reproductive health. I encourage us all to be bold when we stand together in the global solidarity against the challenges facing the world's girls and women, ensuring that they are empowered to make safe and healthy choices regarding their health and well-being. The answer is not simple, but I believe each and every one of us has a role to play. Thank you.
Thank you. Thank you. Thank you, Your Royal Highness. Barbara, the Global Health Corps is breaking many traditional molds. regarding capacity building and partnering, and looking at new ways to address global health challenges, and particularly women's health challenges. Can you share with us some of the ways in which your organization is plowing new ground?
Absolutely. Thanks, Carl. Thank you.
Yay!
Thanks, Carl. As Carl mentioned, I have been lucky enough to work with several young leaders through an organization called Global Health Corps that I founded in 2009. But I also was lucky enough to arrive a day early at this conference, and I got to meet with the 100 young leaders that Women Deliver has brought to participate. And of course, spending the day with these young leaders yesterday proved that they already know, and they've already seen in their own eyes, that we must work to invest in girls and women in order to really move the needle on health issues. And sitting in a group of 26-year-olds and under yesterday really proved to me that we have a lot to be hopeful for as we work on women's and girls' health issues. As everyone knows, we are living in a very unprecedented time, and that right now we have an unprecedented youth population. 50% of the world is under 25, and 90% of developing countries is under 25. And while often we hear of this youth bulge as a concern, I think we can also take advantage of this youth bulge to really move the needle on women's health issues in two ways. And obviously, we must harness youth to address women's health issues in order to make a bigger impact. And so, as I heard mentioned a few times earlier today, one of those ways that we can take advantage of this is through the demographic dividend. If we can ensure that young people right now have access to reproductive health, family planning, education, and economic growth, we really can leverage young people to be drivers of economic growth. And we've seen that happen in Asia right now, and we're hoping that that can continue to happen around the world. Another way that I think that we can really take advantage of this very young population is, as Carl mentioned, through addressing human resources for health. Young leaders right now know that they have to reach across borders and sectors and disciplines in order to affect greater change. And this seems to be a pretty incredible opportunity to channel talent and new leadership into the field of global health. Right now, we are living in a time when young people are more globally minded and connected than ever before. And in 2008, I was at a conference with the Kronprinsessens as well. And it was a conference that Peter Piot was hosting at Google, and it was called AIDS 2031. And Peter got up on a stage like this and challenged the entire audience to think about what we could do to harness the passion, energy, and skills of our generation to address major health challenges. And through that conference, I ended up meeting the 4 other males, none of whom are here actually. I need to get them at women's conferences more often. I ended up connecting with my co-founders of Global Health Corps. And what we are trying to do is ensure that young leaders from around the world see that they have a huge role to play as a change maker in addressing global health challenges. So what we do is partner with existing nonprofits and government agencies focused on healthcare delivery. Partners in Health and Clinton Health Access Initiative were our first 2 partners, and we've been thrilled to partner with PSI, the Ministry of Health in Malawi, Rwanda, other terrific nonprofits and health ministries working on affecting greater change in global health. And our partner organizations identify areas of need that they have, and then we recruit talented young leaders from around the world to work with them for a year, filling those gaps. Our fellows work on a variety of health issues like access to family planning, prevention of mother-to-child transmission of HIV, strengthening health systems. They are already leaders. They are filling gaps that exist in global health now and will continue to work on these issues throughout their careers. And one thing that is pretty encouraging to me is this year, our placement focused on women's health issues were the most competitive placements that we've ever had. As Carl mentioned, if you're going to be a Global Health Corps fellow, it's more competitive to work for us than it is to go to an Ivy League school, which makes me pretty excited because that means that there is a huge desire to work on global health issues from young people. Our fellows always work in teams of 2, which is critical to us. They work one fellow from the country where we're working partnered with an international fellow, which means that this year our fellows are from 12 countries. It is truly a global group of young leaders addressing global health challenges. Throughout the year, not only do they serve within organizations, but we train them, we invest in their leadership development, their mentorship, their professional development so that they can leverage this 1 year into a career as a change maker. And pretty important for us is to get their voices heard in policy dialogues. As we know, since 50% of the world is under 25, we should have 50% of those voices represented in policy to ensure that we're building policies now that will serve young people throughout their careers and throughout their lives. So one thing that's been pretty exciting for us, as Carl mentioned, as that we have been able to work on sort of very non-traditional health models. The majority of our partner organizations, when we started working with them, did not request traditional medical skill sets. Instead, they wanted tech backgrounds, management backgrounds, monitoring and evaluation backgrounds, design backgrounds. And what is so exciting about that is that you can really open up the field of global health to any young leader and show them how they can be part of the solution. So what that means is that our fellows are working to build holistic health systems that can address women and girls' health right now in East Africa, Southern Africa, and the United States. And what that looks like is very different each place that we're working. It looks like 10 young architects that we are working with in Rwanda, 5 of whom are Rwandan, 5 of whom are American. And what they are doing is working with Partners in Health, the Ministry of Health in Rwanda, and a design firm called MASS to redesign the way that health centers are built so that airborne illnesses like TB do not spread to everyone that walks in the door. These 10 fellows are still architects, but they have made small changes in the design of these health centers so that air flows differently throughout the health center, therefore not perpetuating airborne illnesses. And these 10 fellows obviously are now global health workers as well. And they are bringing new ways of thinking to the field of global health in Rwanda and will continue to do so as they design new solutions to treat health issues for women and girls. Thank you. They also look like fellows that we've had that were coming from the private sector that had formerly been working on supply chain for corporations. And now they are working in Nano, Malawi, which any of you that have been there know that it's a very, very rural district in Malawi. And those fellows specifically have been strengthening the supply chain of not only drugs, but also HIV testing kits. And in the first 6 months of our fellows working in Nano, they were able to implement a delivery and tracking system to ensure that there was a 50% reduction in lost HIV testing kits, which of course allowed more mothers to be tested to find out if they were HIV positive, allowed for them to have their babies tested to see if they were HIV positive, and of course from that would ensure that they could continue to get the drugs that they needed to live happy and healthy lives. So these are just 2 examples of very non-traditional skill sets in the field of global health that we are thrilled that young people are bringing to the table. For us, it's critical to allow more opportunities for young people to work on women and girls' health because we know that they will continue to be advocates for these issues as they navigate their own career paths as change makers and hopefully end up in positions of greater influence where they can shape policy for their peers and elders living in the countries where they're from. So I am thrilled to have the opportunity to work to foster a global group of young change makers that are addressing women and girls' health issues now and will continue to do so throughout their lives. Thank you.
Thank you very much, Barbara. Anna, there's a risk, and I know I'm guilty of it myself, of looking at women as beneficiaries or recipients in the healthcare system, when in fact they are, in many cases, prime actors in that system. So by broadening our lens to look at not just women's health, but women and health, what can we learn about Cairo and the unfinished agenda there?
Thank you, Carl, for that wonderful introduction to what I'm going to talk about today. And good afternoon, everyone. My colleague spoke about the critical unfinished women's health agenda, which is huge. The Cairo dream has not happened yet. It's still far from materializing. I want to make one additional point, and that is that health conditions at different stages of a woman's life are very closely interconnected, both from a biological and a health systems perspective. Let me give you two examples. For instance, if a woman suffers from preeclampsia and eclampsia, one of the 5 major killers of pregnant women, she is at a much higher risk of developing chronic hypertension later in life. Or if a woman suffers from gestational diabetes, she will also be at a much higher risk of developing type 2 diabetes when she gets older. That means that health systems, and in particular providers, need to be ready to address the continuum of care throughout a woman's life. There seems to be consensus among the global health community about the importance of strengthening health systems in order to face the overlapping unfinished women's health agenda and the emerging epidemic of chronic diseases that affect, in particular, low and middle income countries. A larger and more effective health workforce and a stronger demand by better informed and more empowered women are also essential elements. At the Harvard School of Public Health, we developed what we think is an innovative approach to all these elements that I just briefly mentioned, women and health. We work on women's health along the life cycle, but we also focus on the amazing roles that women play as healthcare givers at all levels of the health system, and also at the different ways these two elements are interconnected. I couldn't think of a better venue to describe what I'm going to do next in the next few minutes than this conference, because women deliver healthcare. Let me explain a little bit how that works. Our premise, in fact, is that women in their roles as health caregivers are an invaluable resource to move the women's health agenda forward and the family health agenda forward as well. Women are the primary caretakers of the health and well-being of their families. They usually care for children, for the elderly, and for the disabled, for the chronically and for the acutely ill in their families. They also, women and girls, in fact, in the household, handle the duties that will ensure the health and well-being of their families. They decide about the diet, they promote healthy lifestyles, they cook, they clean, they fetch the water. They are completely essential for their family's health. But their contributions are not valued, they are not recognized, they are not supported in any way. In fact, we strongly believe that women in the household provide an amazing subsidy to societies that hasn't been recognized yet. Harshad talked about the incredible role that women play in communities. Most community health workers, in fact, are women, and they care for families, for men, for women, for children that don't have access to institutional health. But their work is under-supported, they are under-trained, if trained at all. Harshad was talking about volunteers. Many of them are not paid at all, or those who are often underpaid. And they are not efficiently linked with the rest of the health system through a functional referral system. Women also provide the majority of caregiving in the formal health system. Most nurses and midwives are women. A majority of medical school students are women. But unfortunately, in spite of that overwhelming majority, not enough is being done to support them to achieve their full potential. There aren't enough enabling policies that would allow women to balance their professional roles and their personal roles in the family, particularly those related to reproduction. Very often, women in the health system are paid less than their male counterparts, and sometimes they are even discriminated against. Sadly, very few women make it to leadership positions. In public health schools and in academia in general, we see a similar situation. A majority of students are women. At the Harvard School of Public Health, my school, 70% of students are women, and the majority of people graduating with a global health degree are women. But there is a dearth of women in leadership positions in academia. In fact, I've recently found an amazing piece of information. Of the top 20 public health schools in the US, only 5 are led by female deans. In conclusion, women play critical roles in the formal and informal health system, yet they continue to be under-recognized, undervalued, and undercompensated, and not fully empowered. Unleashing the potential of women is critical to strengthening health system and therefore improving the health of women. This is the goal of our program. And let me give you 2 or 3 examples of how we are trying to accomplish it. With the Lancet, the very prestigious medical and global health journal, we established the Women in Health Commission that brings together 18 outstanding experts in the fields of women and health. With them, we are estimating the financial value of women's contributions to health in those many different roles that I briefly outlined. We are also looking at the interventions, the safe and effective interventions that exist to cover the various needs of women throughout the life cycle and where the gaps are. We are paying special attention to older women. We hear a lot about young women, and that's completely amazing, but we also need to recognize that the voices of older women are not heard enough, that their needs are not taken into consideration as they should. We are also documenting the challenges that nurses and midwives migrating from poor countries to developed countries face, leaving their families behind and needing to adjust to a completely new environment. And we try to influence the global discussions on women's health post-2015, providing evidence and also actionable recommendations for governments and global partners. Let me give you a second example. Through the work of the Maternal Health Task Force, which is our flagship program of the Women in Health Initiative at the Harvard School of Public Health, we do implementation research on strategies, innovative strategies, to improve the quality, the technical quality and interpersonal quality of maternal health care. In collaboration with our partners in Ethiopia and India, we are doing that through a gender lens. We are trying to identify what are the special opportunities and challenges that women as healthcare providers face and how to support them. We are also contributing to building the next generation of leaders in maternal health, most of them women, and trying to empower them to fulfill their full potential. Through these and many other innovative activities that we are doing in partnership with many colleagues and organizations represented at this conference, we contribute to the health and well-being of women and families, the most vulnerable ones, and to the creation of an enabling environment for women in society and in the health system. Thank you.
Thank you. Thank you, Anna. Professor, you speak often, I've heard you speak often and passionately about the role of today's adolescent population in the world, and we've heard it mentioned before, how we have to better address their needs, and also how this largest generation ever is going to define the future reality for all of us. So what's the best way to organize ourselves to meet their challenges, the challenges of that upcoming generation?
Thank you, Carl. I often speak about this group of adolescents because I have 4 daughters. And so it's both something that is personal to me and also, I believe, has relevance in the world. Your Royal Highness and my distinguished colleagues, let me start by looking at several things. First, let's speak demographics. On the 31st of October 2011, the world reached 7 billion. Out of that 7 billion, 2 billion are young people. And when we say young people, we mean those that are below the age of 30. And 90% of these young people are in the developing world. Now, that presents in itself a special challenge and some opportunities. I'm going to come back to that. But when you disaggregate the data a little further, what you find is that adolescent girls between the ages of 10 and maybe to 18 actually form 600 million of these. Now, and I'm talking now of adolescent girls across the world, not just in the developing world. Now, when I ask myself, and I've listened now to my distinguished colleague from JPIGO talking about HPV vaccination, can you imagine if we can actually expose all the 600 million girls to vaccination? That means that we would eliminate 250,000 deaths every year.
Yes.
That's what it means. But I'm not even going to talk about disease. I'm going to talk about progress. I'm going to talk about how these girls can make a difference in the world. We have heard and we know that when you have young people, especially young adolescent girls, exposed to education, and they can reach their full potential, what it means is that they can contribute positively to their economies. I mean, for an example, we know that if for every year of education that you give to a girl, she can contribute, you know, to the 1% growth in the GDP of our country, if you take it together. And these are the things that we need to address. Now, I don't think we should also look at it in isolation, because we've been accused, and I've been accused, and I take it very seriously, that we talk about young girls, we don't talk about young boys. We're taking both together. Adolescents and young people around the world are asking us to act in a totally different way. And I believe that that's something which we need to do. Now, exactly how we do it is the question that Carl is asking me. It is not about numeracy and literacy. It's not about going to school. When you look at what happened in North Africa, you know, the young man who burnt himself actually went to school. It's about educating young people for fit for market, so that they can be able to get jobs, so they can be able to be creative, innovative, and do the things which they really want to do. From UNFPA perspective, what we would like to do is also to add value to that. Teach them about sexual reproductive health and rights, and ensure that every country has a comprehensive sexuality education program that empowers every young person to make choices in their lives. Barbara talked about demographic bonus. The demographic bonus is not given. Every country that has young people, and we're talking 90% of these young people in the developing world, where 70% of those countries are below the age of 30. If, in fact, they do not take the appropriate steps by, you know, providing good quality education, good health care, and comprehensive sexuality education, and access to family planning, they are not going to make that demographic transition, which will lead them to take advantage of the demographic bonus. That's where UNFPA stands. That's where we act. That's where we provide assistance. That's where we work with PSI, IPPF, USAID, the Gates Foundation, to make sure that we can direct the energies so that young people can have this access. The greatest challenge before all of us today is how do we empower these young people to be able to have these opportunities? And the context varies from place to place. I was so happy today when the Prime Minister talked about that family planning is a human right. We need to empower people all over the world to be able to do this. Now, my brief is about that, but I'm going to add something to it because I want to talk about how we do that on the ground in every country, integrating it and making sure that there's resilience and robustness around the services. The world has seen a wave of resources with HIV. We are beginning to see another wave of resources coming out for family planning. For it to be sustainable and for us to be able to do what we have to do, we must integrate these services. Provide HIV testing, counseling and testing, make sure that antenatal services are there, make sure that immunization services are there, make sure that we can provide family planning. More importantly, reach out to young people so that they can make choices. I have a country that I visited where 8% of the pregnancies in the country occurs in teenagers, but 36% of the maternal mortality occurs in the same age group. They're dying to have services, and we must give them. And the services have to have quality. UNFPA works in this arena. We care about young people. I want to be the savior of the 600 million adults and girls in the world. Thank you.
Thank you, Professor. I don't know about you out there. Actually, up here, it's so cold, I'm thinking of building a little fire here in the middle. But the conversation has not been cold. It's been warm. And now we have a little bit of time to talk among ourselves about some of the themes that have been brought out here. And, you know, I think there are a number of cross-cutting and common themes that come out. One that I heard is the need for us collectively to meet women and girls where they are, to bring services to them. Another is the need to look for solutions in unconventional places. And I think we have some good examples of how that's happening now. Another is the fact that our challenge going forward after this period of tremendous resource mobilization in global health is not so much mobilization, but integration to really leverage everything that's been built or is being built. I think also, you know, we've heard we need to look at the contribution that women are poised to make and will make, as opposed to them simply as recipients of services. And finally, I think a comment that I've heard from several is demography is not destiny. It can drive progress, it can drive misery. What really matters is policies that are in place to take advantage of the human energy that we know is there and is still coming. So these are various themes that I think I've heard from a number of different of you in different ways, expressed in different ways. Let me ask, Professor, you know, I think we're in a moment of transition in terms of how resources are mobilized to meet these challenges. In the past, it's been very much about governments, international organizations, foundations. But we know that everything we represent up here is going to be less important going forward in that sense, in terms of where the money comes from to address these issues. The private sector is there, impact investment is there, remittances are there. All those flows begin to dwarf public funding. So what's the right way that we can begin to orchestrate or help coordinate those flows in the post-2015 context? I mean, we represent such a small piece of what is really moving back and forth and that can drive change in the world. How can we help coordinate it better?
Thank you, Carl. I think that before we get to the post-2015, let's talk about pre-2015.
Fair enough.
We are at an inflection point. We're about maybe 950 days, a little less maybe, to the end of the MDGs. We are at a situation where there are actually resources to do more things now in certain sectors than we ever had before. But you are right. For us to be able to accelerate it and do what we do better, we need to coordinate, in a way that we never did before.
Right.
In 1994, the 179 countries that signed on behalf of nation states. And we looked at ICPD as a nation-state issue. Today, non-state actors are more important than they were at the time. And so, in accelerating, we need to bring all these non-state actors together. Now, but the nation-state still must be the leader. So in every country, the country must provide the leadership because, there are too many things government still provides. But I believe that the private sector, civil society, and individuals, private foundations, and various other agencies can actually come together to do far more than doing. Let me give you a good example. We looked at the issue of maternal mortality in Ghana. And we saw the defect in some of the things that was going on. It was one of which we identified was the supply chain system. And what did we do? We went to UPS. UPS is now going to help build the supply chain system in Ghana.
They know how to move things.
That's right. That's right. And this morning, in the plenary, they talked about Coca-Cola. We need to leverage, the strengths of every actor in this arena. But the coordination at the end of the day has to be government. And all of us working in development must respect the state because the state, is the ultimate. It is responsible for its own people. And before I stop, I also think that it's important for us as development actors to advocate collectively, not just individually, collectively with countries to provide adequate resources for its own people. When I look at financial flows, 10% of what we spend in global health comes from ODA. 90% comes from people. Now, unfortunately, 70% of what we're talking about comes from people's pockets. Governments have to provide for their people, and we must have safety nets that are provided by governments for their own people. There's no reason why a government anywhere in the world would expect good quality service if it gives only 5% of its budget to health or gives 5% to education.
Right.
Meanwhile, spends 40% or 50% on arms and ammunition. Yep. Things have to change.
Now stop talking about the United States that way, Professor. But you're absolutely right. No, I agree with that point. And in a way, all the resources that have gone into global health perversely have enabled governments in the South to sometimes avoid that responsibility because big international programs have filled that gap and removed the responsibility from national leaders.
I can tell you that I was Minister of Health in Nigeria, and I would argue with my Minister of Finance, because they would tell me that since the Global Fund is giving me money for drugs, they don't have to be responsible. That is wrong.
Yeah.
Countries must look after their own people.
Right, I agree. So supply chain management, Barbara, the UPS example, you talked about it as well. In the Global Health Corps context, when partners in the South, governments, institutions are looking for help, how much of that sort of supply chain management, back office operations, what does that represent as a proportion of your business?
I would say the majority of our fellowships are focused on health system strengthening, which of course ends up being procurement, supply chain, building out tech systems in order to track more patients. And that's been extremely exciting for us because right now all of our fellows are 30 and under, and 40% are coming from the private sector, and they have extremely relevant skill sets to global health, whether it be that they were working on supply chain management for a corporation or ideally for UPS or Coke, and we could steal them and bring them into the field of global health. But oftentimes when they heard about Global Health Corps, this was the first time that they realized how tangibly relevant their skill set was to another field, that of obviously saving more women and girls' lives and families' lives and people's lives. And I think for us, that's an incredible story to highlight because you really can engage people with different backgrounds. And of course, as we know, the more backgrounds you get around a table, the different solutions that you get from those conversations. And so for us, we've already anecdotally seen how our fellows, though they're young, can bring a different perspective to the teams that they're working on, therefore new solutions, therefore creativity to a field that, of course, always needs more creativity.
Yeah. Harshad, you told some inspirational stories, but you also told, in a way, a heartbreaking story, and that is that VIA as a technique to detect and ultimately treat cervical cancer, was pioneered in 1984. Is that what you said, 1984? All those years of women who have lost their lives, and yet we're still not where we need to be in terms of leveraging that sort of simple technique. And I think that relates to what one of us here talked about, the mismatch between what we know kills and sickens people, on the one hand, and what's available in terms of funding to address it. So give us your perspectives. How can we make some progress against that mismatch problem?
Well, thank you, Carl. I think clearly there are many, many languishing technologies and interventions that have not made the big impact that they ought to. Cervical cancer certainly is one of them, but in many aspects of our care, these are things we have not used. I think we have to fight for unprecedented commitment and support. And one of our experiences is that we absolutely need champions in country to push these agendas. I believe that those champions who understand the evidence base, who recognize the complexity of the intervention, who practice that intervention, who then advocate for it, and who provide leadership is the way to go. I feel that many of the things that we need to do require not just a push from outside, but a real big push and pull from inside countries. To me, that's one of the fundamental investment I believe we need to make. We need to get people in countries to become more demanding of their rights. Oftentimes we talk about creating a demand for our services. I think what we actually need is a demanding generation of women who will demand for their rights. That's what we need. That's what will push governments, that's what will push agencies, that's what will push pre-service institutions to provide the right kind of changes that are needed.
I hope that's true. We do need a generation of women and girls who will push for their rights, but we know that the forces arrayed against that coming to pass are deeply entrenched. Deeply entrenched. And we see evidence of that every day in every one of our countries. I can give you examples from the United States, and we read about examples from Afghanistan and everywhere in between in terms of the spectrum of development. We know that the forces arrayed against that happening, the voice of women and girls being more taken into account, are strong. So, Anna, let me ask you, in your program at Harvard, where you try and sort of tease out solutions to this problem, do you think we have emerging some tools and strategies to deal with that underlying phenomenon of women's place in society in general? What are the most promising tools you think we have?
There's no easy solution. If you look at if you try to find one thing that is common to all countries, to all cultures, is that women are in an inferior social position than men. Mm-hmm. That has happened through history, and it's happening now, with some exceptions, probably in the part of the world you come from. But it's pervasive. So there isn't easy solutions. I think that we should all, in the work we do, we should start looking at things through a gender lens. Or for those of us working on global health, I would like to encourage you to look at everything we do through a women and health lens and start identifying those issues that are different and that represent particular challenges for women, and sometimes enablers. I think that women are perfectly positioned to take care of other women because they will understand what the other women are going through. But sometimes the gender norms are so entrenched, both in men and women, that we don't see that happening. We are working on promoting respectful care during labor and delivery. All women should labor and deliver with dignity and in a kind environment. Unfortunately, there is a lot of abuse everywhere in the US and in the poorest countries. And very often that abuse comes from nurses, and nurses are, in most cases, women. And that's because, to some extent, they have incorporated the norms that prevail in their societies. So I can't give you a straightforward answer. I think it's a matter of looking at things from a different perspective and identifying those concrete tools that do exist in everything we do, so we can empower women and allow them to reach that potential that would make a difference.
Your Royal Highness, Anna's right. Your part of the world leads in this regard, in many regards, but certainly Scandinavian countries seem to have broken the code here in many ways. Do you want to give your perspective on that?
Well, I will. Actually, I grew up in Norway with Gro Harlem Brundtland, as we know, as a major health advocate, and has made a lot of change in the international health scene. And when I grew up, there was a story, a very famous story, that there was a young boy my age that would ask his parents whether it was also possible for a man to be prime minister. So that's the context where I grew up. So I think for a lot of the people, it is a cultural thing. I grew up where I was thought by everyone, also my teachers, my parents, everyone in my society, did not treat me differently. It was very interesting for me because I went to Australia as an exchange student, and I thought it would be completely similar there, where it wasn't. I was treated in a different way being a woman there, a young woman there, than I would be in Norway, which are two fairly similar countries, but for me, I perceived it in a completely different way. So obviously that's a challenge that is a cultural, has a very strong cultural component to it. I think what I'd like to come back to and ask you, Carl, about, which I think is one of the most interesting things coming out of this discussion, is how organizations like PSI and the UN system are going to work together with the countries at a national level now, where you see where funding is going to come from different sources, where it's not going to come from the big donors, but maybe from different private sector approaches, and how do you see that? I would like to pose the question back to you. How do you see that working together on that? Because I think that's one of the, if you're going to really crack the code now, you really need to look at how you're going to provide integrated services and in a coordinating manner. And your thoughts on that would be very interesting for us to hear.
Thank you for that. I think several of us here face that challenge, and all of us to some degree benefit from public subsidy for the work that we're trying to do. But you're right, the expectations are shifting, the funding landscape is shifting, and we shouldn't have the expectation that that public subsidy will be there forever. So what's incumbent upon organizations like us It's to be more creative. It's to be more focused on cost effectiveness. It's to be more skilled at partnering with lots of non-traditional sources and individuals and institutions. Ultimately, we, as a nonprofit working in global health and working specifically in a lot of areas relating to women's health, we have to work under the guidance of the national government. We have to be part of a national program, but we're working primarily with the private sector, which we think is a source of unique cost effectiveness and efficiency as a way to reach poor and vulnerable people. And that model has worked well for many decades, but with a heavy subsidy element built in from taxpayers in your country and mine. And we can't assume that's going to sustain itself. So cost recovery models, more efficiency, better allocation of the subsidy so that it goes only to those who really need it, close work with governments, and partnering with the new actors in this space, many of whom are represented at this conference, corporations, who increasingly, I think, see their future business in understanding this market that we have worked in for many years. This is their future growth market. This is where their growth comes from.
Yeah, Carl, you know, I'm the executive director of UNFPA. I think I am. But I'm going to wear a different cap today. As Minister of Health in Nigeria, I learned something in terms of strengths of national systems. There is what we call the IHP Plus system, in which all of us sit down with government to actually build a health plan for the country. Comprehensive costed health plan. And in that circumstance, once you cost it, then Barbara comes and says, I'm going to bring architects to help you do this. You take that away from it. Carl comes and says, I'm going to make sure that I can distribute condoms better than anybody. You take that away. But the strength of that system is that there's an oversight by government itself to doing that. And the coordination is by all of us. So you ensure that your input into it is actually additional value and is not taking anything away. What we've lost, what has happened in many countries, and it's still happening today, is that there are too many small projects and they are not talking to the system. They go in. When I was looking after HIV in Nigeria, I had to report on 5,000 sources of income. People come, 20,000, they want a report. So after some time, we stopped them and said, let's sit down and build one plan for all of us. And that's the way it worked. And that's the only way accountability can be there. And that's the way we can be sure that if you put 20,000 in it to provide condoms, I can track that condom to where it's supposed to be. So it is all of us helping government to strengthen itself, to build accountability, to make sure that the portal of entry is known, where it is going is known, and we know what the money does, where it goes.
But you need the leadership of governments.
I know. I mean,
critical.
That's the point I'm making.
Yeah.
It is absolutely essential. There is no way you are going to do this without government. Now, the question you asked about the issue of gender and all of that, I think it goes beyond. Anna, you are right. That's a fundamental issue here. You know, and we have to go back to the social system and structures and education. You find that the books that kids use in school today still has, you know, John playing football with father and Jane cleaning in the kitchen with mother. Now that has to change. We have to socialize children in a totally different way to tell them that there is no difference between Jack and Jane. Yeah.
But your 4 daughters, I'm predicting that your 4 daughters have wider and broader horizons than perhaps the generation of their mother.
My 4 daughters I brought up as human beings, not as girls.
Bravo. There you go. Let me ask anyone who would like to respond. So we've talked about a lot of different things, and the challenges, the whole premise of the conversation is that women's health requires a very holistic response, and that even with all the ambition we had in Cairo, which has been unfulfilled, we weren't broad enough in understanding it. So we know that we require even more holistic solutions going forward. Complex, difficult to manage, lots of different players. That on the first hand. On the second hand, these are interventions, presumably, that for which the impact may be difficult to measure. It's not as direct as condom social marketing. It's not as direct as IUD insertion. Trying to address the ecosystem that governs these challenges is going to probably require some leaps of faith. And I guess the question for any of us is, do we think there is patient women's capital out there? Do we think there is, from any source, national, international, non-traditional funder, traditional donor, the sort of resources that will allow the risk-taking and the timeline
2, 3.
T, T, ha. Sound this. 1, T.
Test 1, 2.
So that the moderator doesn't have to sit back and forth and everyone goes back to anybody. what you're going to say is, thank you very much for your time. Thank you so much. And I'll do you in case he is sorry doesn't show up. Theo, so SOWS, of the African American will give us the last one. And then
Yang dulu aku gak kangen.
handphone.
Kalau full memang misalnya
Yeah, yeah. If we're a little late, it's not going to kill anything. We'll give her an hour and 30. She can I'll make
Oh, I see. We have our names.
I think that I cannot chase either of them. Because
Do you want me to try to
somewhere hanging here. Never mind.
You say the stage is very cold.
Okay.
It's freezing. That's why I wore my jacket.
All good? Thank you very much.
Hope we manage.
Yeah, it's stuck to my shirt. No, just to my pants, please, if you don't mind. Sorry, it's uncomfortable this way.
It's okay.
Okay, thank you so much. Okay. Okay.
I changed it myself.
Oh, you...
No, it's okay. It was too short.
You're all comfortable? Yeah. Cecile? Would you like some? Yeah.
Thanks.
Thank you. Distinguished guests, dear friends of Women Deliver, it is a great pleasure to be here today as we look at the challenges and opportunities facing women in leadership. We are fortunate to have with us on this panel 4 extraordinary women, women who, as we would say proverbially, have made it, women who have risen through leadership ranks to attain leadership positions in different fields, women who are widely known and highly respected by those who follow the work they do closely, women who are also sometimes criticized, even attacked by some people for the work they do, for the positions they take, but they are leaders whose decisions and actions have made a significant contribution and continue to make a significant contribution to the life of very many girls and women around the world. In a nutshell, in essence, they are role models. But when I said earlier that these are 4 extraordinary women, the operative word wasn't women, but it is extraordinary. You might wonder why I say this. Well, if we had men seated here around me on this panel who had achieved the same things, who had been so successful in their careers, we wouldn't be describing them as successful. Well, we would be saying they are successful, but we wouldn't be describing them as extraordinary. And maybe this is something to consider for a little bit later in our discussion. They are 4 women whose trajectory in life and in their careers has been quite different, one from the other. They have grown up in different parts of the world. They have grown up at different times in our history to a lesser or greater extent, each one of them facing her own set of challenges, but also making her own set of sacrifices to carry out the work that each one of them so passionately believes in. Their experience, of course, as you can imagine, wasn't always an easy one. They often have had to work twice as hard to get rid of some of these nagging stereotypes that often follow women on their way up. They have pushed the boundaries that still hold women's progress to a large extent back. But despite their achievements, there's still a lot of work to do, you might say. Are they just some of the very lucky few who actually make it to the top in all these different fields? Are they some of the few lucky ones? Or can what we will hear from them today give us an understanding of what it takes for a woman to actually create opportunities, not just for herself, but for women in the country, in the society where she lives, and far afield as well. And I think it all begins with the importance that success means for girls, not for women, because so much of our personality is developed to a very large extent during our childhood, when we were just still girls, dreaming about pushing those boundaries, dreaming about becoming leaders. So I hope we will hear 1 or 2 things about that. Now, over the next 90 minutes, we'll learn more about their personal journeys, the challenges they face, the tough choices they've had to make. We will hear about the source of their inspiration, their motivation, and what they have been able to impart onto others. We'll talk about, as I say, those obstacles, but I also want us to focus, hopefully, on the positives, on the true opportunities that have been created for women leaders around the world. And I hope we'll be able to learn much more about the childhoods, about education and the role it's played, not so much education in the academic sense, but the kind of knowledge that has been imparted onto each one of you through the people who you have lived with, grown up, surrounded by, parents, grandparents, aunts, uncles, teachers at primary school, and so on, people whose wisdom remains with you today. So let me now briefly introduce each one of our panelists, who you'll agree don't need much of an introduction. Tarja Halonen is the first president, woman of Finland. She was in that post for 2 terms, from 2000 to 2012. President Halonen was for many years a member of parliament and also had a great career in trade unions and non-governmental organizations, a lawyer by training. She was justice minister in 1991 and Minister of Foreign Affairs from 1995 to 2000. And as Justice Minister, I think there was a lot of interest as well and focus on human rights on your part. President Halonen is member of the Council of Women World Leaders, which is an alliance or a network of current and former women presidents and prime ministers around the world, all working together collectively to come up with plans of action to try to improve and empower women and improve their status in the world. In 2000, she was the co-president with Namibia's President Sam Nujoma of the Millennium Summit at the United Nations, presiding over no less than, at least 160 heads of state and government. I would say, 99% of them men?
About, yes.
Maybe. It must have felt good. Yeah. Cecile Richard is, since 2006, president of the Planned Parenthood Federation of America, an organization that has worked for almost 100 years now to build a healthier and safer world for girls and women. She's widely known for her work in women's health and on issues such as reproductive rights, leading this well-established US-based organization and expanding its healthcare services to some 3 million people, also allowing access to sex education to about 1 million others. She has been very active on behalf of Planned Parenthood. Her campaigns have in fact doubled the number of supporters the organization has, and she previously founded and served as president of America Votes, which is a coalition of national Democratic affiliated organizations in the United States. Cecile Richards also serves on the board of the Ford Foundation, which supports all kinds of projects that focus on reducing poverty and injustice and also promoting democratic values. Chelsea Clinton. How do I introduce Chelsea Clinton? Well, Chelsea Clinton is Chelsea Clinton. She is a board member of the Clinton Foundation, which works through partnerships with individuals, organizations, corporations, and governments throughout the world to improve global health by focusing on health issues, economic empowerment, leadership development, and racial, religious, and ethnic tolerance and reconciliation. She's also a board member of the Clinton Global Initiative, whose stated ambitious goal is to turn ideas, brilliant ideas, into action through innovative projects and partnerships. Chelsea is also a member of the board of the Clinton Health Access, which works on strengthening integrated health system, particularly in the developing world, and bringing care and services to patients who suffer from such diseases as AIDS and malaria. So a lot of very important work. She's also previously worked for McKinsey & Company, Avenue Capital Group, and New York University. She is special correspondent for NBC News, and I don't know how you find the time, she's also pursuing a doctoral degree at Oxford University. Yakin Ertuk is a former UN Special Rapporteur on violence against women. She's a member of the UNRISD board. She's a professor in the Department of Sociology in the Middle East Technical University in Ankara since 1986. She is currently a member of the European Committee on the Prevention of Torture, and Professor Ertuk has also been director of the United Nations Division for the Advancement of Women, Department of Economic and Social Affairs. In fact, you held that position in from 1999 to 2000, and are also director of the United Nations International Research and Training Institute for the Advancement of Women, or at least you did work as such for a couple of years. Well, these are our panelists. Some of what I said are some of the things we all know about these well-known women. So hopefully in the next 90 minutes or so, we will try to uncover some areas, some facets of their life that we haven't heard so much about, that help us explain who they are, what they think of women in leadership, and how women lead in a nutshell. I think still much of a mystery to many men in this room and far beyond. So we'll do our best. Let me begin with President Halonen. Madam President, you were born, if I can give just a little preview, at least on your background. You were born and grew up in a traditional working class in central Helsinki, in fact, during World War II. And I don't mean to age you in any way, but during World War II, a very, very important time. How much did that experience shape your worldview later on in life? And how much did, for example, the kinds of things you learned from those closest to you, from your mother, who you once described as a true survivor, how much did that shape the way you saw the world later in life?
So, yeah, we all know that how important the mother is as a role model. And my mother had a much more difficult childhood what I had, because that was in 1920s, 1930s. So when she was born, it was just before the Civil War, and then when she was a young one, we had already the two wars, Winter War and then the Second World War. And putting it very briefly, she always said to us when we complained sometimes that, oh, that's not nice, that's not fair. So I said, yes, my dear, the life is not always fair, but that's why we are here, that we make it better. We didn't like the answer, I can say it, but then in the way, I think that she gave us also not only her feelings of the mother, but also the feeling of the collective solidarity. That's why also you are here, that you will make it better, that you don't get everything as good as you hope. But also I think that then my mother's second husband, he was also very, very good, encouraging, and he had two daughters to look after, and he said always that, yes, the girls can, and of course you have to study. But he said something what was not typical Nordic. He said that you have to study well and to get the good jobs, because I cannot decide which kind of the husband you will take. Might be a good one, perhaps not. But anyway, you have to earn your own livings and your children and be free to make your choices. I hope that he has been happy with our choices. But anyway, so I mean that since the beginning, the message of my home was that you have been economically independent, but you have to have also the collective responsibility for the others. And that's it.
Words of a wise man. We often talk about the role of mothers, but of course the role of fathers and stepfathers can be equally important in pushing us forward. You were a very popular politician among Finns. In fact,
so they say, yes.
Well, so the ratings say. Your approval ratings reached and peaked at 88% in 2003, which is really unusual for political leaders to attain this level of popularity. So not only did you do well, you were popular at it.
But not in the elections, after the elections. But I think that our people was very fair, that in the elections it's always quite much 50-50 or a little bit more, not too much. But then afterwards, when you ask that whether he or she is doing well, they are quite fair to say that, yes, okay. And that was those figures what I received. But the joke by the Finnish media was that, oh, that's a bad picture about Finland. They don't think that we are still a democratic country.
But this was before the second election, which you won, but you only won it in the second round. So one wonders if the woman effect maybe had waned. Why do you think you were able to connect so well with people? And how crucial and critical a role was it for you to be a woman?
So our women got very early the full political rights already in 1905. We were first or the second. It depends anybody from New Zealand here. We have a competition which was the first country. But anyway, one of the first ones. And then when 2000, we were campaigning to get the 11th president of Finland. So there was clearly a trend to get a woman. So in previous elections already, our defense minister, she was a very strong candidate, but she didn't quite win. So Martti Ahtisaari, then the Nobel laureate afterwards, he was a winner. But then 2000, it was a feeling we had, I think, 5 or 6 candidates who were women and one man. And in the second round, then we were man and woman. And I think that even we adults, we didn't say, nobody said that it's a between gender. No, they said only the best candidate. But then afterwards, then when I became elected, I received thousands of letters written by small girls who said, yippee, I want to become also a president. So we thought that the society was very equal concerning the gender. But in the matter of fact, these little girls were much more honest, telling that they found that in those days we haven't had any prime minister woman, now we have. And we have, by the way, the slight majority of the women in the government, exactly just now. But then the feelings were so strong by them. And then I think that many of you just have heard this story. The little boy wrote a letter to me and asked, is it true that only the girls can become, in Finland, the president, that boys cannot? And then I answered to this little, I think, 8, 9 years old boy that, no, my dear, it's not true. Also, the boys can become a president, but it is not a job. Do your homework at school, and then you can become whatever you want, lorry driver or the professor, so. And then if you want to serve your country, you might be one day a president. By the way, now we have a male president. But I can continue the joke telling that the constitution of Finland allows only 2 terms. I have done them. Thank you.
And so you could come back. Okay, great. Cecile Richards, you were born into a well-known political family in the United States. Your mother, Ann Richards, is the governor of Texas. She's the former governor of Texas. You graduated from Brown University and then went on to work on Capitol Hill for another well-known woman politician in the US, Nancy Pelosi, the Democratic leader of the House of Representatives. I suppose that in your case, making it wasn't so much a novelty. I mean, you'd seen so many examples around you, both in the family and in the political environment within the United States. How did growing up then in such a family and in such an environment where women held such high political office influence the kind of path you then, later on in life, decided to take? And I suppose that if your mother can become governor of the state of Texas, and I hope you won't mind if I called it a macho state, then anything can happen. I mean, it's a major achievement.
Yes, in fact, in retrospect, it's almost a miracle if you look at Texas now. Although, and I have to say, because Tarja here is, of course, we have not yet done what you've done in Finland, but I am happy to say I know I will live to see the day that we elect a woman president of the United States of America, and that keeps us all going. Well, actually, it's kind of funny, though, because I grew up in a family that wasn't, my mother was, frankly, a traditional housewife, we called it back then. She took care of the kids, and which I think it was probably all those years of pent-up frustration that finally made her burst out in the political scene years later, because she'd stored up a lot of ideas. But, you know, I was much like Tarja's story. I mean, I grew up at a time in which my parents were involved in every movement that came through Dallas, Texas. The civil rights movement and the women's movement and the farm workers movement. And so I think I did grow up
I
just...
feel that generation.
There, it was just sort of feeling that, like, that was what you did with your life. And so I'm grateful to my folks for that. And then, of course, eventually my mother did run for office. But those were back in the days when women were not running for office at all in Texas, or much less across the country. But I think now it's exciting in the U.S. to see, of course, women do extraordinary things. The fact that we finally have 20 women senators has made an enormous difference in the U.S. And I feel like but parity would help us on a lot of the issues that we work on.
And you mentioned your mom, obviously, and she's played quite a significant role in your upbringing. I mean, you were exposed to so many issues and people maybe by following what she did, if not accompanying her on some of her campaigns. How similar, how different are your style of leaderships? How would you describe yours?
Well, we were very, very close. She's passed on, but it's actually kind of wonderful. There's a play about her now on Broadway that sort of shows there's another little boomlet of Ann Richards going on, which has been kind of fun to see that her legacy lives on. I think I've always been more of an outsider. I run an organization now that serves 3 million folks every year with health care. I've been a union organizer. I've been a political organizer. And I believe that, for all the good people in office, they need folks on the outside helping them do the right thing or supporting them when they do the right thing. And I've certainly experienced that with the president we have now, who's made extraordinary progress for women, but it's been, I think, very important to have organizations like Planned Parenthood on the outside, holding government accountable for what they do for women.
And we will talk obviously more about the issues on which you work. But let me just now move to Chelsea Clinton, if I can. Chelsea, you were only 2 years old, I read, when you in fact went on a campaign trail with your parents in the state of Arkansas. I think it was by car.
Oh gosh, no, I think that
is it going back
I
too
definitely
far?
went on the campaign trail while I was still in the womb.
Really? Even before then?
When I was born, my father was the governor of Arkansas, and then he lost the 1980 election.
Okay.
So I don't really have any childhood memories of years absent campaign events.
That's interesting. That must have influenced you, though, while you were in the womb. I wonder how it does, because it must. I mean, there's so much life that goes on, but it must somehow have an impact on us, but who knows? For someone who reportedly, your father said, never liked getting a lot of publicity, you in fact ended up receiving the most television coverage for any child who lived in the White House. How much did those early years, those early travels that you remember, again, being exposed to so many issues, so many people so early on, shape your understanding of the global issues you later on wanted to work on through your father's foundation, the Clinton Foundation, and shape your view of the world and where you thought women fit?
Well, I think the most profound influence in my life, outside of my parents, by far was my grandmother. So actually someone much closer to home, who was born in the United States before women had the right to vote. And she was born to two teenage parents who were not married, people who did not have access to the services that are so crucial that Planned Parenthood helps provide. And she was abandoned by her parents twice before the age of 8. And then when she was 8 years old, she was put on a train looking after her 2-year-old sister from Chicago to Los Angeles to go live with her grandparents. And when she arrived in Los Angeles, her grandparents were not overwhelmed to see her. And she quickly came to understand that she would have to work in the orange fields every day after school. And then when she turned 13, her grandparents summarily and without ceremony kicked her out of the house, saying that now she was an adult and that she was expected to stand on her own 2 feet at 13. And so she got herself a job as what she always referred to as a mother's helper, sort of what we would think of as a live-in nanny today, and still went to school. She had to literally kind of run 5 miles to school every day after she had dropped off her 3 young charges at their school and run back to pick them up. And I share all of this because she was so determined to create a different life for her children, to create a life for her children that only existed in her imagination, to create a house full of love and support so that her children, particularly her daughter, could grow up and be anything that she wanted to be in America. And my grandmother passed away a 1.5 years ago, but before she did, even though she was born before women had the right to vote, she lived to be able to vote for her daughter for president. And that, to me, really is the power of community. Because even though her family abandoned her, she did have, you talked earlier about sort of inspirations. She had teachers who supported her. She had the family that she lived with who supported her. She had people when she moved back to Chicago who took her in to support her when she went to secretarial school. And she still fundamentally believed in people's goodness, and she fundamentally believed that life was not about what happened to you, but about what you did with what happened to you. And she instituted that sense of sort of self-empowerment and self-agency in her 3 children and in my mother. And I cannot imagine my life without my grandmother. And so when I have traveled with my parents, whether throughout the state of Arkansas or across the world, or now traveling on behalf of the Clinton Foundation, I think about my grandmother every day. And what more can I be doing, can we be doing to ensure that children everywhere have people who believe in them and who have systems that work for them, whether or not their families are able to provide the same care and support that I was lucky enough to have.
Very interesting. And you talk about the important role your grandmother played in instilling in you the idea that women can be anything they want to be. But can women today really try to and be successful in breaking that ultimate glass ceiling that we heard about in the last election? Can they really today realistically hope to get to the highest political office? How confident are you that this can happen, say, even in 2 years from now, perhaps?
Well, Cecile spoke about the fact that we now have 20 senators, but we being women, lost seats in the House of Representatives in the last election for the first time since 1994. And so I think we have to be very careful about not mistaking progress for success. And in the United States, we've been stuck around 17% in a variety of different arenas now for a very long time. So about 17% of the Fortune 500 C-suite, the corporate executive offices, the CEO, the COO, the CFO, the chief marketing officer, the chief administrative officer, are women. We steadily made progress in the 80s and 90s, and then that kind of upward trajectory just stagnated. The same is true in our legislature. The same is generally true in our state legislative systems. The same is generally true in many of our top universities. And so we have been stuck. So that says to me a couple of things. One, that we've done a very good job of ensuring participation, at least in the United States. Women are a majority of university graduates, we're a majority of medical school graduates, we're a majority of law school graduates, we're a majority of many different PhD programs, we're increasingly a majority of vocational school graduates and two-year college graduates. So we have really worked on kind of ensuring access and participation, but we haven't yet sort of figured out the different facets that need to come together to ensure that women continue to progress into leadership roles. And then to ensure that kind of those examples can become role models for the next generation. And I think there are many implications that we can talk about what's the role of the public sector, the private sector, NGOs, to Cecile's point about having civil society hold government, but also private companies responsible for making decisions that aren't only the right ones, but ultimately the smart ones. Because if we continue to leave a whole gender behind, we're not going to live in the future that my grandmother imagined for her daughter, or I know my mother wants for me and the grandchildren she hopes to have.
And well, yes, and if you have time for those, I mean, you've been very publicly, politically active recently. Well, I say politically, but taking on a lot of work.
Please feel free to share that with my parents. They are shameless.
Just in case they didn't know.
In public and in private.
But I mean, you've taken on a lot of projects. For the Clinton Foundation, you even visited Myanmar just a few days ago.
I came here from Rangoon.
Working on a clean water project. Some might have read more into that, suggesting that you were following in your mother's footsteps, who'd recently, well, maybe a year ago, had been to Myanmar. Talking about going to top universities too, you seem to be following in your father's path somewhat by also going to Oxford. Should we be reading more into that?
No, I don't think so. I mean, I fundamentally believe that those of us that can do things should do things. And before my grandmother passed away, she encouraged me to be more responsible toward the opportunities that I had been given. And so I'm grateful that I could be in Myanmar over the last couple of days for a couple of different reasons. One, Procter & Gamble made a commitment through the Clinton Global Initiative in 2010 to, by 2020, be giving away 2 billion liters of clean water every year, which equates to saving one life every minute of every hour of every day of every week, to ensure that children are no longer dying of things like severe dehydration due to diarrhea, which I find unconscionable that in the 21st century people continue to die from things that we've known how to prevent and treat since the 20th century. And also for the Clinton Health Access Initiative, we recently signed a memorandum of understanding with the government to help ensure that they're more affordable and accessible and reliable procurement and distribution networks for things like AIDS drugs, but also childhood vaccinations. So I'm I'm grateful that I listened to my grandmother, and I'm looking forward to the work we're going to do in Myanmar over the years to come.
Okay, well, let's now look at maybe the status of women in a completely different part of the world, in Turkey, in the Middle East. Professor Yarkin Ertug, you come from Turkey, which I think we can both describe as a modern yet conservative society with an overwhelmingly majority Muslim population. How would you describe the status of women today? How much progress has been made?
Well, how much time do we have?
A couple of minutes, enough time.
It's very difficult to, of course, respond to such a question because the whole issue of women in the Middle East in particular is a very loaded concept in itself. And I think we have many stereotypes. Some of them are being discussed at this conference on different platforms. Now, of course, Turkey entered the phase of modernization at a time, in 1923, as the Republic was established, at a time when the world also had a very strong modernity perspective, which is no longer the case today. Today, conservative politics is the trend in all parts of the world, not only in the Middle East, but internationally. And this conservatism, of course, is threatening many of the gains that women have made everywhere, particularly in the area of reproductive rights, which is the main controversial area. But I was very lucky to grow up in a period when state feminism saw women's advancement as part of the advancement of the country itself. So it wasn't so much belief in women's rights, but using the advancement of women as a criteria of being part of the civilized world. So that gave us certain rights early on, such as equal right to education, civil rights in terms of marriage, property, divorce, etc. And modern Turkish men were given a mandate by the state to raise modern daughters. So one academician in Turkey has framed this modern fathers, modern daughters. And I definitely had a very modern and secular, open-minded father, a middle class. He was also an academician. The only resource he could pass on to his children was education. We didn't have wealth from the family, and we couldn't afford to go back to the rural areas and work in the field. The only path for us, like families, was education. So I think very much in line with President Hallinan, that was the only option I had. And along the way, of course, when I was doing my PhD at Cornell University, the first World Conference on Women took place. I was raised as an empowered woman, making my own choices, without necessarily ideologically framing it in a feminist perspective so vividly. But I think the Women's Conference and the way it trickled the message across helped me and women of my generation to critically analyze our personal success in terms of the wider gender inequalities that exist. So I think I was lucky to have very positive male and female role models around me, a state feminism which opened the path for advancement, and a very vibrant women's movement in the 70s, which formed my more feminist critical perspective as a woman.
And you seem to say that education was key
Absolutely.
in your upbringing, obviously, and in being able to empower yourself. But we still see around the world, certainly in more traditional conservative societies, women who are educated, who still bend to the will of their patriarchal societies, who still confine themselves within the so-called traditional and cultural limitations. How do you see tradition versus progress and religion?
Well, I think tradition and modernity are not very useful dichotomies. It's a forced dichotomy. What is traditional, what is modern is less comprehensible today than it was maybe 20, 30 years ago. We could define these concepts easier. But what has happened, particularly after the Cold War and with globalization, that culture has become the domain of politics, unfortunately. And today we are defined in terms of cultural attributes rather than our professional and individual attributes. And in that respect, again, the woman question has become the main determinant of the differences of cultures. So today we look at the Middle East, for example, when we're talking about the Arab Spring, where there was so much enthusiasm at the beginning. Today we're a little bit ambivalent as to where this is taking us. How do we understand this? Why have some of the gains that women have made under authoritarian repressive regimes are being questioned today, and is democracy a paradox for women? You know, these are all very serious issues. Well, one thing, of course, this is again an area which requires very detailed discussion, but alternative masculine claims for power have only one area where they can distinguish themselves from the previous governors, and that is the area of morality, woman, family. Whereas when you look at their economic policies, there are convergences in how they see economy vis-a-vis their previous rulers. But the main distinguishing area, of course, is greater control over woman and family and public morality. And these are some of the dilemmas, and as opposed to what I was describing as a more progressive, modernist outlook in the early 20s in the world, where there was an incentive for emancipation of women and so forth. That is not the case today internationally. Unfortunately, particularly for the Muslim world, being Muslim has become constructed for good reasons or for fear of Islamophobia and so forth. For the first time in my life, and it's a pretty long life, I am being having to define myself or cope with the definition of being Muslim, which was not an identity that I had previously. So I think we need to look at what is happening in particular parts of the world within the wider global spectrum, because we're not living in isolated worlds anymore.
We aren't, and you're quite right. In Muslim societies, President Halunen, women's progress is often blamed on, or the lack of progress, on men. The fact that men don't necessarily want to see power shared with women, that they don't want to see them on an equal footing. But even in the more secular societies, such as Western society, certainly in Europe, and in your experiences, are men simply to blame for this, or is it up to women as well to empower themselves and to shake off some of these stereotypes?
Yes, I think that it's always both and. You have to make involved. I always say when it's a gender equality that 50% plus 50% makes 100%. So when we are trying to get now these underused resources of the feminine side, women's side, to be now in more accepted capacity, we don't mean that you will have less. We mean that you could have also more individual aspect on this, because not all men are alike and not all women are alike. But if the women themselves don't understand that the women's rights are the human rights, and one of the core issues in the human rights is your sexual identity, your sexual and reproductive rights and health. So the men cannot do that. I mean, we have to be emancipated with ourselves. But it would be much easier if we have a partner, husband, father, son, and friends, who are male and who understand it too, because we need both sides. And what I could say from the experience from the Nordic countries, which has considered very much to be already quite equal standing in that way. I call them Nordic sisters, not Nordic brothers, these countries. So it's a little bit encouraging you. So I think so that we have seen also the different types of the roles for the men. In a way, they have get also more power in the areas what earlier was considered to be the women's issue, like how to raise the children at home and so. But now there are more and more also men who say that I will consider that my family life is so important that you have to give me my paternal leave, which is now accepted in Nordic countries. And in matter of fact, when you share them with the man and the woman, so this harmonized cooperation with within the family life and within outside world, like in labor force and political life, and so it's much easier. It's more understanding that all human beings have these two roles, at home and outside of home. And then I think that it has made it more feasible. But as I said, it's always concerning the equality. Those who are now getting more, they have to be empowered by themselves. But also, the fellow citizens have to be with them. Otherwise, you cannot do it in a nice, how could I say, harmonious way.
And there is that sort of idea that women are more emotional, that women in position of leadership handle themselves differently to men. Some will counter-argue, obviously, and will quickly give you the example of Margaret Thatcher, but on a whole, is there some truth to this fundamental idea that men and women are different in positions of leaderships? Do you have to be ruthless, cynical to succeed?
No, I think that it might be so that there are differences in your genotype, but I think that we don't know it exactly. There are certain features, perhaps, but I think that the most important is to see the male and female as 100% human beings, right. Because I think that, for instance, emotions and instincts, they are very important for men and for the woman, to be sensitive for what you are seeing and hearing and feeling. But you have also your brains between your ears. So it's always the combination, I think.
And we have something in common.
Yeah, and that's, I think, that the others have also something to answer. Of course, the close relationship with the mother and child, we know it, I know it from my experience, is important. But when you see how the child and the father look each other since the first moment, when you give a chance to that, so you see that the ties between the children and adults are mainly psychological. So give also the opportunity for the fathers in this sense. Thanks.
Cecile Richards, you have to be sensitive, President Halonen says. Do you also have to be thick-skinned as a leader? You have taken a lot of heat, and for those who don't know, the issue of reproductive health, particularly in the United States, you'll argue in other places as well, is extremely thorny and quite divisive. The issue of abortion is always a big sticking point in any political campaign. You face regular, sustained criticism, even attacks. Does it bother you? Do you pay much attention to it? How do you handle it?
Well, no. In fact, I guess I'd say, in the last couple of years, just sort of because of some political sea changes, and particularly in Congress and some state legislatures, not only reproductive rights, access to birth control become somehow controversial, sort of like we've gone back to the 50s. And so personally, I feel like, when I feel like whether these attacks are personal on me or on the organization I have the good fortune to work for, I think it just makes me even more committed to do what I do. Because I think, the women who are counting on Planned Parenthood for basic health care, for access to birth control, to make their own reproductive health care decisions, like, we cannot let them down. And that's how I feel like when I'm dealing with the US Congress. You can't be so. But I also think, I just wanted to pick up on what the president was saying, because to me, I feel, despite sort of the current environment in the US, which is so tough right now on a lot of issues, I feel incredibly optimistic about the next generation. Because I do believe that, even though in my mother's time it was the women's movement and women were sort of supposed to carry this, every single thing on their back, I feel like young men are part of this movement in a way that has never been sort of as true. And we saw this even in the whole efforts to end Planned Parenthood access in the country, that there were literally 2 million new supporters joined Planned Parenthood in the last couple of years. And hundreds of thousands of them were young people. And they were almost as likely to be young men as young women. So to me, it is about the role of men now in child rearing and the family. And we certainly, to take it in the political sphere, we saw in this last election where women's access to health care was actually front and center in this election, that young men were as progressive as young women on these issues. And that, to me, means, lean in to the next generation.
There's no doubt women still have to make some hard choices and personal sacrifices in order to be in positions of leadership. Chelsea Clinton, you are in somewhat the unique position of having seen up close how women and men lead politically. Having, let's face it, being the daughter of the most prominent, I think I can say the most prominent political couple in US politics, what are the most obvious differences, do you think, between men and women leaders? Do women lead much more by instinct, or do they simply admit much more readily to it?
Well, this is something that my mother has spoken about, that she has felt both when she was outside government, as a member of civil society, whether kind of in the 1980s running the Legal Aid Society in Arkansas, or in the mid-1980s she brought Mohammed Yunus from Grameen Bank to Arkansas to help set up the first microfinance agriculture bank in the United States, to then when she was First Lady to being in the Senate and then serving as Secretary of State, that in all those different capacities when she was outside government trying to fill gaps, kind of setting up the microfinance bank in Arkansas that she thought really should have come from the public sector or the private sector, but didn't, and so kind of was an imperative for the for civil society, or being in government, that a willingness to listen and to collaborate were what she found to be more likely to come from women than men. Not whether women were more likely to be emotional or a-emotional, or analytical or not analytical, deliberate or instinctual. She found those qualities, or the absence of them, to be fairly equally distributed. But she did find, and she has remarked on this, so I think it's best to sort of cite her, that a real willingness to listen to various opinions from various sectors, from those in the corridors or well beyond the corridors of power, and a willingness to collaborate across party lines, as well as between the public, private, and civil society sectors, she found to be more native to the women that she worked with than the men.
And do you think that women can have it all, that they can have successful professional careers and also be successful at home? Did you find that that can be the case?
I hope that every woman gets to define all for herself. I mean, I think that is what success will be.
Can I add to that, that once the journalist asked when my daughter was about, I think, 11, 12, and then I think that could be a journalist asked that, how do you feel now when your mommy is so busy in the politics? How do you feel to be the mother? So my daughter answered that, I don't know, she is my own mother. And only one.
And I
that's the only mother.
I can empathize with that.
And you have the same.
Yes, when people ask me, what is it like to be my parents' daughter? I'm profoundly grateful, but I'm also, it's a failure of imagination. I can't imagine, thankfully, not having them as my parents.
Yeah. And how conscious does that make you feel about the need to, in a way, impose your own independent self, to create your own brand? Because, I mean, we all know you as someone who works very hard within the Clinton framework, the Clinton Global Foundation, the Global Initiative, and so on. How important is it for you to, really
I'm
put
very
your own
grateful
independence
that
down?
my parents always have supported me. They certainly have always had high expectations for me, but they have always been rooted in whatever I would choose to do. And I think each one of us always has to ask and answer, where do we think we can make the maximum difference? Kind of where are our talents and energies kind of best manifest? And for me, that very much has been through the Clinton Foundation, and that the work that my father started in 2002 really to change the market dynamics around HIV AIDS drugs is work that I'm now privileged to build on top of to help do the same in fighting diarrhea. And partly because it doesn't make me squeamish to talk about diarrhea, and I always know that I'm in a good crowd when no one laughs when I say that. And that I think too often there's a pressure that many people feel to be first. And that's an understandable pressure, to be the first to innovate or to set a record or to come up with a new idea or start a new program. And all our lives are made richer and more interesting and healthier because of that pressure. But I also think it's important sometimes to think about, what is already working and what can we do to build on top of that, to expand, to take to scale, to leverage what already exists. And I am really grateful that what I'm really passionate about kind of matches with work that my father started and that I can now help take forward.
Following on an important legacy and pushing it forward. Cecile Richards, when we look, I mean, obviously women like yourselves have done a lot of great work around the world. How important, though, would it be for an American woman, from an American woman's perspective, to have a woman in the White House? Would she be perhaps more understanding of women's issues, of the importance of putting women's rights on the agenda? Are you surprised that no woman has made it yet in the US when you've got women leaders in many much more conservative societies around the world, in Africa, in Asia, and Latin America?
We've just been getting ready, so we're just about ready to do it right
how
now.
Soon do you think it might happen?
Yeah.
How important is it that it happens?
No, I mean, look, it's important everywhere, but there are women in office that I completely disagree with on every single issue, so I certainly don't think this is any panacea. But I think, though, the balance has been important. Look, we just, in the United States, we finally passed health care coverage for all Americans, almost all Americans, not quite. We still have immigrants that we need to cover, and we're going to go back and get that job done. But it would not have been the same, the coverage that we got for women, the coverage of women's preventive care, the finally equity in what insurance cost if it hadn't been for women leaders. And I think it's just an important perspective to have. I mean, to not have to debate over whether maternity benefits should be covered, which we literally had to fight for in the United States Senate. That's why we need more women in office, is to have another perspective. But can I go back to something else that you asked, Chelsea? Because it just is something that I feel like is a bit of a, it's an important point, I think. And I really want to thank all the people that are here and Women Deliver for really raising up and lifting up the importance of the work that collectively everyone here does and folks do around the world to give women a fighting chance. And that is, I think we get caught up in this thinking, can women have it all? And I started my early career organizing low-wage workers, women in the, worked as nursing home workers and as hotel workers. And these were women, many of whom were single moms. They were working not because it was perhaps uplifting, but because they had to feed their family, support their family. So I guess my perspective is women have always done it all. And it really isn't, and that's, so to me, and I think that's important to remember that what we're doing here collectively is just making sure that women have a fighting chance at equity. And that, boy, I mean, Chelsea gave a couple of good examples. I think, too, back when my great-grandmother was a girl in Texas, the only people that could not vote were idiots under the law, idiots, imbeciles, the insane, and women. And to think that 2 generations later, my mother was actually elected governor of the state of Texas just shows, like, if you give women a fighting chance, by God, we can get it done. So
I was right in calling it a macho state.
What's that?
I was right in calling it a macho state.
That's right. Anyway.
Great, Cecile. Now that's interesting to listen you talk about. I wonder how that kind of fits with Professor Ertug's experience as a woman from the Middle East. Again, when you look at the generational shifts that you've seen, how hopeful is the picture?
Well, it's very contradictory, isn't it? I mean, if you look at it from the perspective of Turkey, I grew up when modernly dressed women were the face of Turkey's modernization. My mother was an educated middle-class woman. She was a teacher. My grandmother is from the grassroots, a devout Muslim, but I think she was, like Chelsea, like Cecile, a great role model for me. She was a very empowered woman, and her mind was very open. And whatever I did, she very much approved and encouraged me because she respected education and a new way of life. She never obstructed my advancement with the kind of rhetoric that we hear today, that this is against our tradition, this is against our religion, that just didn't exist. My grandmother would say, my daughter, if you are doing this, you must know what you're doing. Go ahead. This is the kind of a vision this woman had. And, so we come to today. Today, the new generation is portrayed in a very different way because there is more conservative politics, which is symbolizing women's presence in public space in a very different symbolic manner. And these are very disturbing differences. I don't mean just the superficial notion of the headscarf. A woman can cover herself or uncover herself for different reasons, but it's the politics around that and what it implies for women's place in society that is of great concern. Turkey is a secular country, but there are very disturbing developments. On the one hand, we are living through a peace process today. Just 2 days ago, there was a very important peace conference in Ankara, and I was very much instrumental in its organization. And this is the first time we're capturing a historic moment like this. And I very much appreciate the current government's initiative for this. But at the same time, you find very contradictory things happening. The Prime Minister talks about abortion as being murder, whereas this is a country where legal abortion has been practiced for years, and abortion levels have gone down since it has become legalized. So it's hard to understand the logic. Well, of course we do understand, but the motivation is not simply out of benevolent reasons. So these are disturbing issues. Or the call for a woman to have 3 children. I would have wanted to have half a dozen or a dozen if possible. But again, coming from the highest levels of the government, one wonders, without providing any services for women who may choose to have 3, 4 children, daycare centers and so forth, are we, without calling it by name, sending women back to the domestic sphere? So these are disturbing issues. But I just wanted to comment on what Cecile said, pick up on what she has said. Yes, women have been out there. My grandmother was the force. She was a woman who was working in the village, while my grandfather was the Gentile person who was the governor of the town that we lived in. She was the one who was really doing the labor and so forth. And women all around the world, they have taken care of their children, their families, pretty much, sometimes even on their own. But what is, I think, important today to recognize is that because of the women's transnational movement of the past 30 years, a great success as a result of collective women's leadership has been achieved. So women who reach such positions today have a great support behind them, whereas before, a woman had to struggle on her own and sometimes give up or sometimes become a brutal leader. I mean, we know women leaders who have not contributed, let alone to the women's cause, to human cause. So it doesn't help to be a woman alone to make a difference. There are women who are motivated to make a difference, but they become empowered because of what the collective women's movement has achieved up to today. And I think we need to recognize this and celebrate it.
President Halonen, you've worked with many women leaders.
Yes.
How do you see the picture?
In the matter of fact, how all that started was that Marie Albright, who was in those days the foreign minister of USA, she started to invite the female foreign ministers in the UN General Assembly meeting. We were not too many in those days, but then the group increased, and so that became also very public, that there exists such kind of the system. And now we have continued with the networking for 2 reasons. One has been that we are encouraging the new ones, saying that what they claim to you to be, it's not you, it's a stereotype. Just think with yourself and with your collaborators that what you are yourself and not the stereotype of the opponent. And then the next is that there are also such kind of the challenges universal challenges, what we can perhaps help. And for instance, every one of us have mentioned that how much women have worked through the centuries and also today in all parts of the world. And they should have an equal footing for this work. For instance, that if you are an entrepreneur, you have to have the same rights to get the credit or to own the things, or you have to have the same rights for herit. And if you are a farmer, that you can have your own piece of land. And for instance, many women are working in the developing world, especially in so-called gray zone, which means that it's not quite legal, but perhaps not quite illegal, but it's invisible work. They can be the small shops and so on, and they should get on equal rights legally and practically so that they can become better in that way. And I think that here, that's the basis also for the so-called leadership. You can be leadership in different places, but that also builds the society, even the highest posts.
I think that that's a fundamental point. You know, in looking at the world writ large of countries that have some sort of elected legislative system, the United States ranks 89th in terms of women percentage of our House and Senate. And countries ahead of us include many that have quotas. You know, Afghanistan is ahead of us. But in Afghanistan, women don't have the same access to credit. They don't have the same legal rights within their marriages. They don't have legal rights to their children if they were to get a divorce. And I think too often we look at the metrics that are the easiest to access and then extrapolate kind of the progress that we hope to see, instead of really kind of understanding, you know, well, what are the full complement of rights that women need to have to be able to chart their own course. And that often legal rights, whether it be, you know, inheritance or the right to own property or the right to be able to kind of see or continue to parent their children if they get a divorce, are arguably more fundamental to whether or not there's a mandated minimum threshold of women that are elected to the national parliament. So I think that that's such an important point that President Halloran just made.
And it isn't just, as you say, Chelsea, about one woman reaching the highest political office in the land when the majority of women are left far, far behind. But President Halloran, just getting back to you briefly, I mean, you were in a position of leadership. You were in a position where you were able to make a difference, perhaps, on legislation and to make sure that women's rights were expected. Do you feel that you did enough? I mean, in 2009, Forbes magazine listed you as one of the 100 most powerful women in the world.
I think that
do you see yourself as that, and do you think you used your power well?
Well, I think that the bad conscience is something natural, at least for the women, can be also for the men, so that you always feel that you could do it better. But then you have to be realistic, that you do what you thought that was the most important. And I would say so that at least I have been broken with the others, some of the glass ceilings. I have been not only the first female president in my country, but also the first female lawyer in the trade union movement, and the first female political minister of justice and some other things. And there have been many after me. I mean, nowadays they say, what's so miracle with that? And I hope that in one day, when we have now already the slight majority of the women in the government, in one day, perhaps my grandchildren will say that, what's so, my granny, why they say that it was so special that you were president and a woman? That they would understand it, that it can be man or woman, but it's just for your personal part. But I would say that there are a lot of other things. For instance, in business life, in corporations, still very seldom you see women at the leadership. Even they might have a lot of female staff, personnel there. And we know already, based on researches, that those companies make the best results which have the both genders in their decisive bodies. Right. So just to select the best ones and not only what you had used to do. And so in that way, I cannot say that I have done enough. I could say that I tried very hard. But Yeah, I'm very thankful for both the women and men
Are
who
you
have
still
been
trying
working.
hard?
Yeah.
Are you capable of making much difference when you are once again a private citizen?
It could
when
be.
you're no
The
longer president?
history tells only one truth. I think that it's for the researchers to say whether I could do more. I'm too. I'm not objective enough to do that work. No, I don't know. I don't know.
Cecile Richards, you also, I mean, although you never held political office, Time magazine, I believe in 2012, considered you one of the 100 most influential people in the world. I mean, do you take this type of, I guess, compliment very well? I mean, do you think it's important, the work you do? And how would you want to use your influence better than you have so far?
Right. Well, that recognition wasn't about me. It was really about Planned Parenthood, I think, and not just Planned Parenthood, but I think sort of we became a little bit iconic in the fight for women's rights in the U.S. And it was literally millions of people across the country, young women and men, who I think stood up for women's rights. What that was about. I think, I guess going back to your question about the difference it would make to have a woman president is, I would hope that, and it kind of goes back to your point, that when a woman does become president, which I hope is very soon, that it's incumbent on all of us who are not in office to be there to support her in advancing not just women but men as well in the U.S. and progressive values and social justice and that's so to me. I would hope that's what, in the current job I have, where we have an organization that sees 3 million patients every year, but also 7 million supporters, that one of our key roles is to not only be there to provide health care, but to really be a movement for the rights of folks in the U.S. And I think we're quite aware, and why I'm so pleased to be here, and we really want to thank the people of Malaysia and the government for having, and all of you for having this conference, is that I think we're quite aware in the U.S. that we can't back down and we can't lose ground for women, because we feel like we want to be in solidarity with women all across the globe who understand that the ability to plan their family and to control their own fertility is key to their ability to have to sort of live the life they want to live, and that's what I feel like is our duty and our responsibility.
Professor Atuk, looking at Turkey, what motivates women like you then to make sure that they too can push the boundaries and make sure that they can play the role that they want despite the constraints that we know?
What motivates me is anger most of the time. Anger that things are not moving enough, and I think it's good. Francis Kissling talks about rage, which gives you the courage to act, and I very much, I think that's what I take on. And of course, I'm an odd member of this panel. I'm very privileged to be sitting here with these fantastic women. I think I'm more on the side of the silent or invisible collective force of a leadership that has created this atmosphere, contribute to this atmosphere. But I was just thinking of, we're talking about women who make it up there, and what the problems they face and the contributions they make. But there's also a very symbolic aspect to having women in place. It's not only that it's because of equitable representation that we want women there, but when a woman gets there, it becomes inspirational and motivating for others. And I'd like to give the example again of my own country. As you know, we had in the 1990s a female prime minister, and as a social scientist, I thought it would never happen in Turkey in the foreseeable future, but it did happen, and it was a right-wing government that produced a female, and this is also an interesting thing to really sort of deconstruct and understand, but I will not get into that. But what was interesting is Tansu Çiller was a young and very feminine woman, which we were not very accustomed to seeing in public space, because in Turkey, a public female figure was a man-like figure. They dressed in very man-like and so forth. And that's how a woman made it. And prominent positions. But Tansu Çiller was this very feminine, and she used her femininity in a very skillful way. And it was fantastic seeing her walk and these 20 men behind her with mustache running after her. And she was a disaster as a politician, and a double disaster as in terms of serving women's cause. But the symbolic contribution her presence made was phenomenal, because she motivated many women to become more aggressive in getting into politics. And still today, Turkey's parliament is only a little bit over 10%. And ironically, it has increased with the current government. I say ironically because just a few minutes ago I was saying modern, tradition. These are very confused terms today. It was a government that's associated with an Islamist ideology, and yet they have brought more women compared to the Social Democrat parties. So these are very confusing issues. But young women today are very much vocal, and part of it can be attributed to Tansu Çiller's feminine presence. But it has been a fantastic symbolic motivation, I think, that it can be done, particularly in a country associated with very strong patriarchal heritage, that a woman making it there and having an authority respected, I think is something valuable in itself. Of course, we would like, as we meaning the woman of the world, we would like women to lead, but how they lead is more important for us, of course. We want transformative leadership rather than leadership per se.
And as you say, Professor Ertug, anger and rage can be positive forces.
Absolutely.
For the men out there, don't get us wrong. We just need to feel angry to do what we must. Chelsea.
May I say something sort of in reaction to that? I remember when I was a little girl and we went to London, and my mother took me to see Margaret Thatcher during Prime Minister question time, and also took me to stand across the street outside of the hotel where Benazir Bhutto was staying at the time, to show me, while, yes, we were there to see Big Ben, to show me two examples of strong national women leadership that were only sort of accessible to me by kind of having been in London. And this is really where I think technology can sort of help provide an amelioration of kind of distance and the challenges of imagining a woman leader in one's own country. That for many of my friends, or for my friends who do have children, for their daughters, being able to watch the Prime Minister of Australia or President Halloran when she was in office kind of on YouTube, it kind of provides that same type of kind of galvanizing force or kind of egalitarian ambition that I had to travel across an ocean to see as a little girl. And I think that that is a resource not to be underestimated. I think technology generally is agnostic, but can be incredibly powerful for not only creating the communities that are so important to support women leaders, or to hold all our leaders, including our women, responsible, but also to help ensure that little girls and little boys are able to see different examples of leaders in different places around the world beyond the confines of their own sort of city or country boundaries.
And I wonder how crucial you would think, perhaps President Halloran, but Chelsea Clinton as well, and anyone else who wants to answer this question, is the world we live in today, the technological advances, YouTube, Facebook, that kind of thing, the media in general, the power of the media in kind of almost imposing the kind of leadership style one should have today in order to succeed. I mean, we know that the media can make or break someone. How important is charisma today because of that power versus the collective organization that Professor Ertug was talking about in making sure that we are efficient leaders?
Yes, it makes, because in TV, for instance, you more watch than listen. Radio is much easier for the politician because you can give your message by listening, and so and of course the TV makes politicians more visible. You can also read the body language, which is important. But sometimes it's also creates a better expectations how you look like. And if you are not born as a beauty, you don't become it when you are middle-aged. So that's it. But this is another way around, that being in TV, you are more like sitting in the corner of your sofa. So it's a different style. And never allow them to take a picture in the big mass media situation, because it looks very funny when you are at home. But it might be very impressive when you are present in the hall. So there's a lot of these things and tricks what the media can use. But you didn't ask, and I know that we have about 3 minutes left, I say it makes also a difference in contents when you have both the men and women in the governments. I don't speak about the one woman, but in the government. It makes more caring. We have invested in Nordic countries, for instance, more in education, in social welfare, in the health, in the environmental issues. So if you want such kind of a sustainable world, so you have to have both men and women in the governments and parliaments. Sorry.
Yeah. Very good point. So in the few minutes we've left.
One thing on, I think Chelsea's right. I think that technology is agnostic, but I have to say the power of social media to allow stories to be told that will not be told in traditional media is so important, and I think that is particularly true for women. And we've seen that repeatedly. In the United States, even the fight over birth control, which was hidden in the halls of Congress, and when the Congress refused to have a young woman testify about why birth control was important to be covered in insurance plans, they held a hearing to get 5 experts to testify. So when the hearing was called, we sat there, and the 5 experts really couldn't say much about birth control because they were all men and they didn't use birth control. That photograph was then taken and sent around the world and completely changed the debate. So I really do believe that it is that I think more daylight or shining the light on all of these issues actually benefits us, and I think particularly for women to be able to get their stories out there in a way that we often have not been able to before. So.
Power of the media. I just wanted to ask Professor Tuuk, looking at it as an outsider somewhat, how important do you feel is charisma today in today's world, as we say, with this 24/7 constant social media coverage? Is there a leadership style that is different today, that is more needed, more suited to the kind of times that we live in?
Well, charisma is always fascinating, of course. People like charisma, and media definitely uses it very effectively. And unfortunately, sometimes charisma gets in the way of the real work. I know leaders who lacked charisma but really left a mark in this world. So I think we should not be, we are impressed with charisma, but we should not be totally engulfed with it and see what is actually being done. And I think for a woman who gets access to leadership positions, wherever it may be, I think it's important to be courageous enough, and I think there's the infrastructure now enough to be that courageous, to be daring and to shake the boat, if I may say. Shake it enough to change course, not to sink. Then you will not be a wise leader. But I think we really need to create, whatever work we're doing, to create contradictions, ruptures in a system so that things can open up new options, particularly for the more marginalized, disempowered people, to gain greater options, to have control over their lives and gain greater access to resources and decisions over their own lives.
And Chelsea Clinton, you've had the opportunity to see and meet many much less privileged people through the work you did for the foundation throughout the world. What has struck you the most? What has stayed with you that would one day maybe impel you to do more as a political leader if you decided to get into this field, if you decided to really be a leader?
Well, I think that fundamentally, what I think we probably all share here at Women Deliver, and there's a strong selection bias in this room, is that we care about dignity and ensuring that every woman has the dignity that she is deserving of and has the tools, the resources, the knowledge to make the right decisions for herself and her family. And I think one of the things that Joaquin said really struck me. Inertia is a very powerful force. And one of the things that I think Cecile highlighted, as well as President Halloran, is that social media really makes inertia less powerful, because there are more stories coming out of more places, and there are more communities that can form to hold power accountable for the future that the collective wants to see. And so as important as I think charisma is, I think that competence ultimately, strangely, is becoming even more important and more valued in a social media-ized world. And I think that'll enable more people to have the dignity that they deserve around the world.
And just very finally, President Halonen, through your long experience as someone who was in that position of political leadership, to what extent would you say, looking at women now who are trying to make it, to what extent is it still important for them to focus on the substance, on the political platform? Is there now much more sympathy towards women making it? Do women have to rely, should they rely on that kind of sort of softer factor, or should they still focus on the real essence of things?
At this historical moment, I think that experiences of the women and men are different. And when we are now making the choices of exactly now, today, so we should benefit about these different kind of experiences and let both men but also women especially to give this experience. And I think that many women have become more sensitive because they haven't had possibilities to act in different ways. Especially when you, Professor, when you spoke about the peace processes, I think that when women and children have been the most victims in the recent armed conflicts, so I think that all that what they feel and also how they have built also the confidence between the individuals and people should be used much more strongly what it has been done now, and to educate and train the women to that. Perhaps in the future it's different. I mean, we are always the result also of the surroundings. But just now, I think that it's extremely important to use all these human capital resources what we have, and that means that underused resources are the female ones, which means, of course, the competition a little bit harder between men and women. But you, the progressive, capable men, you will be also in the picture.
Right. And on this positive and hopeful note, let me say, as we come to the end of this truly fascinating discussion, that it has been a real privilege to listen to the unique experiences of all our very distinguished panelists. And I hope that what we've heard, some of what we've heard here today, will inspire us, will push us to push the boundaries a little harder, to deliver on all these great hopes and aspirations that so many people you meet around the world have. I thank you very much. Thank you, President Tarja Halonen. Thank you, Chelsea Clinton. Thank you, Cecile Richards. And thank you, Professor Yerik Ertug.
You were great.
And let me thank, of course, Women Deliver, the whole team for making this happen. And all of you, of course, thank you very much for being here with us.
Thank you.
Could everybody please stay in their seats? Okay. We're going to have a last, please stay in your seats for 5 more minutes. Each day ends with a last word from someone who has been part of Women Deliver and someone who is working on behalf of women. And we are now going to hear the last word from Theo Soa from the African Women's Development Fund. Theo?
I know you've all had a really long day, so I'm not going to keep you very long. I was asked to speak about the importance of investing in women and girls for a sustainable future. And what I realize is you've had a full day where people have actually spoken to you a lot about why it's both right and smart to invest in women and girls. So going back to the beginning of the day when Jill Sheffield said that sometimes we're long on facts but short on inspiration, I'm going to deal with the inspiration point. And while we've been listening to all of these numbers, all of the data, all kinds of things today, one of the things I've been thinking is that numbers count. But what I'd like all of us to remember is to go back to why we do this. Numbers count, but for me, people count more. And I want us to remember when we're doing this work and when we're struggling and when we're facing challenges and when we look at the road ahead and think how hard it is, that all of the work that we're doing is about our mothers, it's about our sisters, it's about our daughters, it's about our sons. Ultimately, it's about the whole of the world. And that should be something that inspires us. I know that even though I see challenges constantly in the work that we do at AWDF, I'm also constantly inspired. I'm inspired by the young women that I see, people like Amina Doherty from the Caribbean, Jessica Horn from Uganda, who use social media to bring on board whole new generations of young people to fight this battle with us. I'm inspired when I see people like Halima Mohammed from South Africa, who uses her social traditions and her religious traditions to really push for the social change that we want to see. I'm inspired when we go out to projects like Project Alert in Nigeria, who, despite all the challenges that they've seen, looked at what was happening with women in their community in terms of violence against women, and leveraged small amounts of money to build the first domestic violence shelter in Nigeria, but then to go further and to lobby and advocate and make sure that a domestic violence law was in place in Lagos State and encouraged and built on what they had done so that their governor is going outside Nigeria, outside of Lagos State, to other state governors so that there's a proper legislative framework that's in place. And I'm inspired even by the failures. I'm inspired when I go to rural areas and you see that women are dying unnecessarily, because that gives us the anger to make sure that we go ahead, because we are so privileged. We have information, we have knowledge, we have resources, even though we don't always use them appropriately. And so I think while we're here, take the time, learn the stories of success from each other, learn what's failed from each other, but be inspired. Be inspired by the people we see, because if we can make sure that women and girls are really at the heart of the movement that we are pushing forward, the movement that we are all part of, then I think that we will see the change that we have been trying to put in place. And I really ask all of you, while we are doing this, let's make these investments. It doesn't take that much, but let's make sure that we are investing strategically. Let's make sure we're investing well. Let's make sure we're investing not just in individual women and girls, but in women's organizations and in women's leadership. I really believe that we have come a very long way. We've got a very long way to go, but working collectively, we can do it. But we have to make sure that when we do get inspired by each other, we do more than just talk to each other. Let's make sure that at the end of these 3 days, we are taking that inspiration out into all the different worlds that we inhabit, so that we're talking to the unconverted, not just to the converted. So let's get together, let's work together, let's make the most of these 3 days, and then let's go out and continue to transform our world.